Thank you so much for joining us tonight. We're really excited to get to talk with you all. My name is Sophie Fontaine, and I am the Youth and Young Adult Program Coordinator at NAMI Virginia, and I'm also the Director of Youth Move Virginia. So we wanted to kind of take tonight to just kind of introduce ourselves and what we do in part of a series we're doing for youth listening sessions because we as organizations are trying to come together to start building a bigger coalition for youth and young adults and how we can best support you. So tonight we're just going to kind of share with you all what our organizations are doing, and then also some times for question and answer. We will also be answering questions on the Facebook that we will be sharing this on as well. And also make sure you join us October 14th at 5:30 p.m. because we are going to be doing a second part to this series where we are going to be doing a full listening session where we want to hear from you, hear what your needs are, hear how organizations in the state can best be supporting you, and also just some ideas of ways we can advocate for you all. We will also have a brief survey that we'll be sharing after this and as well as on the Facebook page where we'll just kind of be getting more information from you all, and we're going to be using that to kind of build the foundation for our listening sessions. So to start off, Catherine, do you want to introduce yourself, and then we can just kind of go through and start sharing about our organizations and such?
Yeah, I'd love to. So my name is Catherine Clark. I work for SARA of Virginia, which stands for the Substance Abuse and Addiction Recovery Alliance. I am the Young People in Recovery Program Coordinator. What Young People in Recovery is it is a national organization. So we just started a new chapter back in May here in Richmond. It's the first one in Virginia, so it is very exciting. It's really close and dear to my heart because I am a person in long-term recovery from substance use disorder. So this is kind of like a dream to be able to provide support to individuals who have gone through the same things that, I've gone through in my life. So kind of what we do with this program is there's kind of like 4 major components. So we feel like there are specific needs, and that's kind of what this is all about. There are specific needs of this population that needs to be met. So we are trying to provide that through we do bi-weekly meetings. So the second and fourth Wednesday of every month, we have YPR, which is Young People in Recovery, all recovery meetings. So that's just kind of a space that we can come together and just have discussion topics of kind of what we're dealing with in recovery. How are we going through recovery? Are there any challenges? Is there anything how we can provide support to one another? So we do that, which has been really great. We've had some really good turnouts. Also, kind of more on the more fun side, we have monthly free pro-social events. So we get out in the community and we go out together and we do something fun and recovery. So for me, a part of recovery was, I had to break the stigma of recovery is boring, right? Like I was like, man, like everybody else is having so much fun and I'm just not, So we were able to get out in the community. This summer, we had this whole adventure series. We got out with Rams in Recovery, so college-age students. We got out and we did a hike. We went tubing down the river. We did a terrifying rope challenge in the air. It was very scary. More recently, we've done a scavenger hunt. We've also gone bowling. So we're able to kind of promote relationship building and healthy relationships in good environments. So that's kind of another aspect that we're able to look at. We also do workshops. So harm reduction workshops. Why is that important for young people and youth to know about, So learning about that. We also have housing workshops. And we're actually becoming a Narcan distributor. So we'll be doing Narcan training. So that would be really great for us to get out in the community as a whole and be able to help one another. So those are the 3 aspects. And the last one is pretty major. It's advocacy. So we advocate on different levels. Right now, the big thing we are advocating for as young people in recovery is the Recovery High School in Chesterfield. We have had roundtable sessions, and we're able to get testimonies from people, which I think is really important for not only the organization, but we are able to have a say. Young people are able to have a say in what we need, which is another aspect of what this is right here, this listening session. So I'm excited y'all are here. So with that, I will pass to Christy.
Thank you, Catherine. Good evening, everybody. I am Christy Corbin. I am the president of Family Support Partners of Virginia. It is a peer-run and peer support agency located in Hanover County, actually in Central Virginia. We do have a statewide focus in that we provide peer support to parents and caregivers who are navigating the child behavioral health system in Virginia, which can include a gamut of things such as school and the justice system, mental health challenges, substance use challenges, all of the above. And we also have certified and registered peer recovery specialists on staff that can also work with adult individuals who are either entering recovery or are in recovery and looking for some additional support from a peer lens. I am a certified peer recovery specialist and trainer in Virginia, as well as a certified trainer and coach of the high fidelity wraparound model that is utilized throughout Virginia for family support partners, as well as youth support partners. I don't currently employ youth support partners, however, that's on my radar because I would love to have those folks on my team. So if anybody happens to be interested and wants to maybe do this professionally, please have a conversation with me. I'll make sure my contact information will be available. So we also offer trainings, which I just started a new peer recovery specialist training today. So I'm in the middle of, or in the beginning stages of that training. And then I also do, like I said, the high fidelity wraparound training for the support partners. And I also provide other trainings tailored to the requester's needs. I also offer supervision of the peer support workforce. It doesn't matter what their title is. As a peer support provider, I've been supervising peers for a number of years. One of the activities that we are doing in collaboration with the Department of Behavioral Health and Developmental Services is we have established a learning community. We've applied and been awarded this opportunity through Youth Move National. And we will be learning from others across the country and the top-notch folks who know about youth peer support in the nation. How do we bring this to Virginia in a way that is meaningful and sustainable and impactful and empowerful? How do we make this thing work? We do have some youth support partners in pockets across Virginia, not enough. We need many more. And so we are really working on how to make that happen. So that's the gist of what we do, and I'll be glad to answer any other questions as we move along through this. Kayla?
Thank you, Christy. Yeah, and Kayla, so Kayla is actually a youth support partner. So Kayla, would you mind just kind of sharing your experiences and training? Just give us your whole life story real quick.
Yeah, for sure. So I'm a youth support partner through Blue Ridge Behavioral Health Care in Roanoke, Virginia. I work in the intensive care coordination program, which is just kind of one section of the whole agency. And ICC utilizes a strength-based model when working with families and youth. So that's a huge focus of mine when working with the youth. I've been in the role of a YSP for a little over a year now. I think we're coming up on about a year and 6 months. So it's been quite a little bit of time already. And before my job as a YSP, I did not know anything about peer support. I didn't know what a youth support partner was, any of these things at all. So I was kind of immersed into this whole like new world of things. And after getting into it, I kind of realized like how much of an impact a YSP has on mental health in general and substance use and all kinds of things. So it really changed my perspective on a lot of things. I grew up in a household where, substance use and domestic violence was really normal. And I have ended up developing mental illnesses like PTSD and depression and anxiety. And so I had to go through my own mental health treatment, and I didn't really have anyone there to help me use my voice or help me through any of those situations that I was in other than, my family, which was part of the issue in some ways. So really didn't have a lot of people that understood where I was coming from. So when my current job started, I knew that being a youth support partner was exactly what I needed in terms of being able to help other youth that went through the same things I did. So that was really the biggest reason I wanted to do this job. And that's really the main point of a YSP in general. So after being in this position, I just learned how helpful it is, being in those situations, and I didn't have an advocate. So being able to do that now is really awesome. And I get to help kids, share their point of view now. And that's something that I didn't get to do. So I love being able to help them with that. So a YSP helps provide that opportunity to youth to use their voice and share their perspective. Helps them have the opportunity to voice their concerns and have somebody that actually does understand where they're coming from, because we have that lived experience point of view of I've been through that, I've done all that, like I've been in these systems, I've had this kind of treatment and that kind of thing. And that gives it also not just different perspective to the youth, but to their whole team in general, because some people don't, they may not have that lived experience, or there's a gap between the adults on the team and then the youth on the team. So I kind of get to help bridge that gap a little bit, which is another huge part of being a YSP. And it helps them, have the opportunity to be part of their treatment and not just receiving the treatment. So ICC helps develop a lot of plans to wrap around kind of what Christy was talking about. We develop a lot of plans, and a lot of times the youth are left out of those plans, or they just kind of get told what they're supposed to be doing or what they have to be doing, but they don't really get to be a part in those decision-making processes and all that stuff. So I get to take a lot of time with youth on that too, in terms of, you get to decide, do you want to do it this way or this way? And even if they may not have a full choice in everything, they're able to really have as many choices as possible, which is really helpful because they don't feel like they're just being made to do something. They get to actually be part of their treatment, which is a really huge thing when you're receiving that kind of treatment anyways. So it just gives a very unique perspective to mental health and substance use treatment in general, in terms of having a completely unique perspective of things outside of a provider point of view. And it also helps the youth have a different perspective of their own future also, because it kind of provides hope of like, you can go through all these things and still do something very meaningful with your life and in general. And I think that's probably the biggest part of it in general that I've seen as being the most helpful, being able to help kids and the youth get to see their life in a different point of view from what they're used to or they haven't experienced before. So I think that's pretty much it. That's kind of a good gist of what a YSP does and what the importance of it is. So
yeah, thank you so much. Sorry, Kayla, I'm so sorry. I just totally had I mentioned this earlier. I've been having a bit of brain fog today, and it's kicking in hardcore right now. So just to kind of wrap up information about us, like I mentioned earlier, I run Youth Move Virginia. We are a program of NAMI Virginia, but Youth Move is essentially a youth movement. Christy mentioned Youth Move National. We are a chapter of theirs. And what we do is we empower youth and young adults with a variety of systems experiences. We are very foundational on peer support, like all of us are. And we work with people with lived experience in the mental health, juvenile justice systems, education systems, really any experience. And our goal is to support a grassroots network of young people to be empowered and active guides in their own care. As Kayla was mentioning, it's really important that we not only give youth a seat at the table, but also let their voices actually be heard. And so we do a variety of programming. We offer, we do twice a month, we do youth groups. Those are online and they're really fun. They're activity based, and we just kind of come together and we give you an hour of time to just kind of talk, play a game. We do like Kahoot quizzes. We'll do a lot of fun stuff. We also have a few leadership trainings, and those are really useful if you're a young person who's interested in learning more about leadership, whether that's how can I be a leader in my family, in my friends, in my school, starting a club. We have a variety of young people that come with all different goals in mind, and it's great because a lot of them get to work off of each other and learn from each other. So we're going to be sending out a follow-up email to everybody who's registered with more information about all of us and our programs. But we'd really love to take some time with you all now and just kind of see if you have any questions. This could be really anything you have in mind, anything about our programming, anything about the state. We wanted to just kind of give you all the floor. And don't forget too that we will also have our youth listening session in 3 weeks, I think, 3 weeks, October 14th. So if you don't get your question out right now, that's all right. We will have time for it next time. So yeah, we wanted to give our participants the floor and see if you had any questions, but I am going to stop recording now, just so nobody has to feel like they're going to be on our live video.